Fantastic. So again, I appreciate you taking a little bit of time to talk to us today amid all of this. So, start things off, we'll go through these questions. First thing is, we know one of your cardiologists was exposed to COVID-19 through a family member who was returning home from New York. Can you just explain what happened?
Sure. Well, I want to let you know that as of 10 o'clock last evening, we communicated to all of our employees at Washington Regional just what you've said. And that is, at 5:30 last evening, just a few hours before we circulated this, we received a call from the Arkansas Department of Health that the first positive coronavirus patient in Northwest Arkansas had occurred. And indeed, just as you stated, that was the family member of one of our providers. At 8:30 on Monday morning, I received a call from one of our departmental directors stating that a provider was in the hospital who had told the director that one of his family members had come in just before midnight Saturday night from New York, and that individual was experiencing fever and symptoms of an infection. So with that information, we immediately sent that provider home and told the provider that you must be quarantined at home until further information is obtained. We sent a home health nurse to the home with full protective equipment and obtained a specimen. And then at that point, that was couriered to Little Rock to the Arkansas Department of Health. We then, last evening at 5:30, as I mentioned earlier, received the fact that this family member indeed was positive for coronavirus. The Arkansas Department of Health asked that I call the provider, which I did, notified them that indeed their family member was positive and that they and their entire family must maintain quarantine at home for an additional 14 days. At the time that I spoke with the provider, he remained absent of symptoms, and I spoke with him this morning as well and remains absent of symptoms.
So, knowing that from the information we have, this girl traveled through XNA whenever she came here,
Mm-hmm.
has Washington Regional made any recommendations to them after that flight through?
Well, of course, we weren't even aware of that until, again, Monday morning at 8:30, and the recommendations at that time is that they have to maintain home quarantine. It was a individual under investigation at that point because they were febrile but had no proof. But we immediately, again, had the sample obtained and sent to Little Rock in the most expeditious way of getting the result. They were instructed to maintain home quarantine, and then now the case has turned positive, remain in home quarantine for at least the next 14 days or as otherwise instructed by the Arkansas Department of Health.
What about any recommendations to XNA itself, since that was kind of the port of travel to which?
Yeah, that's really not Washington Regional's purview. That's the Arkansas Department of Health.
Okay, so.
Has the Department of Health, to your knowledge, notified XNA that someone transitioned through their?
That's not something that they would have communicated to me, so we've not received that information from them. Not to say it hadn't happened, it's just not something that it really is the working relationship between the Department of Health and Washington Regional. We deal with Washington Regional in our community.
Sure. So can you confirm that both of the patient's parents are doctors?
Yes, they are both physicians. The one cardiologist that you mentioned is a member of our medical staff. His wife is not.
Has the doctor been tested for COVID-19 at this point?
No. The doctor remains free of symptoms. In fact, again, I asked the epidemiologist at the Arkansas Department of Health who all needs to be tested. And as that they are symptom-free, there's no need to test.
So I know that for a lot of these folks, they don't even show symptoms, but they still do test positive.
True. But again, understand that with limited testing supplies, if you have that individual that is quarantined at home, they are not posing a risk to the public. And as long as they're symptom-free, the amount of viral particles that they're shedding for communication is very low. But the real primary issue here is if they're at home quarantine, there's really no reason to test them because they're assumed infected until proven otherwise.
So as a provider here, could he refuse a test as well?
Well, anyone can refuse a test.
It's a question about policy here at Washington Regional. Are all employees required to undergo testing of some kind with regard to the virus?
Well, all of our employees are expected to adhere to what the CDC recommendations are. And that's in our policies. We've had a number of policies I think have been shared with your station with regards to how we're testing, and we're holding all our employees accountable for that. And as again, I want to make it very clear that the moment that we heard that this individual had a potential exposure. Remember, our provider wasn't ill, but had an exposure. And the minute that occurred, he was sent home.
Right. So moving right along here, you know, we found the family member who ended up being quarantined and has tested positive for this through social media because she posted it on there.
Right.
And she said that your employee here pushed the test through. That was a direct quote from her Instagram post. Was that appropriate?
Well, I'm not going to comment with regards to the appropriateness or inappropriateness of an individual's comment. I think I've pretty much told you the story and the facts of how this occurred.
Sure. So this employee here, will he face any repercussions for coming to work after this whole scenario here?
Our any corrective actions we have with employees is confidential information that we do not release to the public.
Sure.
Hypothetically speaking, without talking about anyone in specific, under similar circumstances, would a provider be sanctioned in some way for behavior that might resemble this?
Well, you know, we're treading on new ground at
I
this point.
realize.
So do we have a policy on how we sanction someone who is, this is the first pandemic to this extent that's occurred, really to this extent since 1918. So I'm not quite certain that our employee policies are up to speed.
Would this prompt
that.
a review of the policy?
Oh, well, absolutely. You know, we always review policies and procedures on an ongoing basis. When new issues arise, new circumstances, you have to look to say, what is your policy on that? Because it's important to have expectations set with regards to employees as to what's right and what's not.
Right. So other sources have said that when the doctor returned to work here after the whole exposure happened, he began doing surgeries again. So after this, he had started doing surgeries again after this. What was kind of the extent of his interactions with folks at that time?
Well, again, we do not comment with regards to patient care issues. You know, there are areas of confidentiality that we really don't want to delve into. I will say that again, this was Monday morning, and that phone call that I received was at 8:30 in the morning. At 8:45, that individual was home.
Sure. So,
Just so I understand, the provider was in the hospital here on the grounds for just about 15 minutes?
Well, honestly, I don't know exactly when he arrived, but it was certainly less than 2 hours.
Okay.
at that time, did he have any interaction with any of the screenings or the testings with COVID-19?
No, he was asymptomatic.
Sure.
Did he perform any operations or interact with patients or
Again,
staff?
that's something that I don't want to get into.
I know in the letter that you sent out to the employees that were here, you categorized it as low risk. Can you just define what low risk is
Sure.
relative to the others?
Well, he's not a patient, first off. Low risk is the fact that he was not a patient, not showing signs of infection. He was a contact with a patient, but had shown no signs of infection, which means his risk of shedding virus, as defined by the Center for Disease Control and confirmed by the Arkansas Department of Health, showed that indeed he should pose no risk to those that he came in contact with. That being said, we need to be prudent. And when an individual has contact with someone who is infected, then just as the CDC states, they need to be quarantined. Not all individuals that have contact will become infected. Not all individuals that become infected will have symptoms. But if you've had direct contact is defined as someone that has had within 6 feet for a limited period of time, 2 minutes typically. If you've had direct contact with someone who is proven to be infected, then you need to be separated from the public. The whole purpose here is to try to limit the spread of this infection. Try to limit the, for lack of a better phrase, exponential growth. We want to try to flatten the curve of infection so that we don't overwhelm the resources of the community. Be that, education, whether that be commerce, whether that be healthcare. We want to try to limit the spread of the infection.
So 36 hours, that was the amount of time that was listed in the release that you had sent to your staff here.
Correct.
Seems like a pretty long amount of time. The virus has also been proven to live on surfaces, so if he was here for a certain amount of time, perhaps it did move on to one of these surfaces.
Sure.
So how do we know at this point that his workspace
Well,
wasn't
the 36 hours is important because The incubation period for this virus is anywhere from 2 to 14 days. It's typically about 5 to 8 days on average when folks become symptomatic. When they're symptomatic is when they're shedding the largest amount of virus. Before they develop symptoms, is there the potential to shed virus? Yes. But at 36 hours, that's in the very beginning of this potential illness. And again, I want to reiterate that the provider is not a patient, has not shown infection at this point. There may be up to 14 days before the provider does show infection, but at this point he does not. And the 36 hours is important because the risk of shedding any significant amount of virus is very low. And that's not just my opinion. That was the direct conversation that I had with the epidemiologist at the Arkansas Department of Health.
Sure. So this question right here even applies later on down the line if the virus does continue to spread and some of the staff here get it.
Absolutely. I think it's pretty clear that the number of individuals within our community are going to get this virus. There's no one who has immunity against it. So again, what are our safe practices to try to prevent or at least slow the spread? And that is immediately if you've been exposed with a significant exposure, and the CDC defines that, and this was a significant exposure that the provider had with a family member. That's why he was immediately quarantined.
Let's say that some staff here do get it,
Mhm.
some doctors, surgeons, whatever, even later on down the line. What's the plan for backfilling those positions if folks are missing work?
We do have a surge plan. We have a plan where we are cohorting the patients. We have an entire unit within the hospital that is specifically for COVID patients. That's one of our intensive care units. The entire unit as of 6 p.m. tonight is negative airflow. Typically you have 1 or 2 rooms, and we did have 2 rooms initially, but now all 20 of our rooms are negative airflow as of 6 o'clock this evening. We are cohorting the physicians that are caring for those individuals that are going into the unit so that they only care for folks in the unit, they don't care for folks outside, and the folks outside don't go in the unit. We also have a surge plan so that if those physicians become infected, then there are replacements. We're very fortunate at Washington Regional. We have 8 pulmonologists that are critical care physicians. So that means we're fairly deep with regards to the number of folks that can care for these patients. Same thing for nursing staff. We will be cohorting the nursing staff as well. Beyond that, should we see very large numbers of patients, we have surge plans in place for what we'll be doing throughout the rest of the hospital. We have another entire wing that we're in process of making that entire wing negative airflow as well. And even beyond that, we have other plans that I won't get into at this point, but we have a sequential way of looking at surge patients.
So we have been talking to several folks here who are staff at the hospital today, and basically what we've heard is that several of them were questioning the policies and the cleanliness and side of the hospital during the time. And they say they're being reprimanded whenever they bring up any qualms of that nature. Can you just kind of tell us what's going on with that?
Well, first I've heard of that. And of course, I'd have to look at those particular issues and questions and concerns. None have been brought to me or to any other members that I'm aware of. Cleanliness of the institution is really not an issue here. We feel like we have a very clean facility. We work very diligent on that. But at this point, really the issue is how we maintain the decontamination of the unit. You may recall that, I think it was 2 years ago, we purchased the Xenon robot, which is an ultraviolet light system to kill viruses just like this. Other than the Veterans Hospital, we are still, to my knowledge, the only hospital in Northwest Arkansas that has one of those. We have got 2 robots, and we've dedicated one for our COVID unit, and we've dedicated one over for our screening clinic over on North Hills Boulevard. So again, we're going the extra mile, we think, to make certain that we keep this virus out of our community, certainly out of our hospital. The comment there is that the governor has asked that each region have a coordinated approach to when we're going to be suspending elective procedures. And in fact, at 2 o'clock today, I visited with leaders of our medical staff to assist us in developing the criteria that will be developed. The governor has asked that members of the hospital administrations of all hospitals in Northwest Arkansas, really all over the state, but by region, review when are we going to pull that trigger. One thing we certainly don't want to do is to create disorganized care in Northwest Arkansas. So we're wanting to do that collectively. And tomorrow morning, all the CEOs of the Northwest Arkansas hospitals will be getting together to match notes to say, yes, when are we going to do that? So what we've told our staff is, we're not going to make that call. We're not going to get in front of the governor. We're not going to get in front of any other hospitals. We're going to collectively do this and do this in an organized manner. Understand that the risks here or once this is within the community with regards to spread. The other risk obviously is conserving protective equipment. So we want to make certain that our supplies, we don't exhaust those supplies. So we certainly have every expectation that we will be limiting and if not completely curtailing all unnecessary surgeries and other procedures in the very near future, but we will do that in a coordinated fashion. We promote a culture of safety at Washington Regional, which means that any of our 3,000 plus employees can go, we have a concern. When our employees state that we have a concern, we take it seriously. We do that in any number of ways. We have an online ability for them to say, here's a concern that we have. We have a culture of safety survey we do twice a year to say, what are your concerns? Just today at noon, we had a live online town hall with all members of our medical staff and all members of our employees that allowed them to basically, because now normally it's live, but today we had to do it online, and we had call-ins and email in questions that you had of us. So every employee within Washington Regional had the ability today to say, here's my concern.
Okay.
Can I interject here?
Yeah,
You might mention the meetings you and I had this morning, the meetings that Mr. Shackford and you had at lunchtime to talk about what we did this morning and this news as far as safety of the staff and visiting with the staff and letting them, their voices be heard.
Sure, well,
Before you start, just on the mechanics here, I will probably be asking questions, but if you can answer to Andrew, that'll help you.
Okay.
You won't have
Make it
to-
look better.
No,
I'm
that's fine,
sorry.
That's fine, we
You're
just,
perfect.
yeah, it's just easier on you, not having to
yeah,
look at.
yeah.
So you wanted to,
Yeah, just, it goes on to your question.
Sure. You know, leaders of Washington Regional have been meeting at least twice a day, and really that's not true. That we sit down twice a day to meet, and many times more often than that. And that's been going on for right at a week now. We also continually communicate on a minute-by-minute basis. Cell phones are good things. Texting is a good thing, sometimes a bad thing, but it's been perfect in this instance because we can immediately respond from all of our directors, all of our leaders, who are also responding to all of their staff. So on an ongoing basis, minute by minute, we have the opportunity to address concerns.
So the mobile screening site, it's been going here for a couple of days now. Can you just kind of talk about how effective it's been to this point?
Well, we think it's been very effective because our emergency room's been pretty quiet. And that's a good thing, because what we want to do is to be able to keep the virus out of our hospital. The first day, of course, of anything like this, when you have a lot of folks that are coming, we had some improvements to do, and we did that. The last 2 days have gone very smoothly. Now, the future weeks will be challenging because as this virus gets more well entrenched in Northwest Arkansas, there'll be more and more folks who are symptomatic. And we have a surge plan for that as well. But to this point, we think it's been going very well. From time to time, we have patients that are sick enough that do have to come to the emergency room. But what we're able to do in a coordinated fashion is send them to a side entrance in the emergency department where they immediately come into a negative flow biohazard room where we're able to cordon them off, get them protected, get our staff protected, and if they have to be hospitalized, get them up to our COVID unit in the least and the most safe way to prevent exposure within the hospital.
Anything else that I'm not asking here that needs to be included if we're going to be saying
I
things
do
like
have a follow-up question.
Mhm.
Going back to the provider and the events as they unfolded.
Mhm.
We had someone who was, I believe the term is presumptively
Yes.
diagnosed,
Mhm.
and then once the test is done, then it becomes confirmed, is that right?
Well, that's not exactly right. What they call it to begin with, everybody has these acronyms.
Right.
If you have symptoms and have reason to believe that you may have acquired the virus, that's called a person under investigation.
Okay.
And then if the test is positive, it's called a presumptive case. And the reason that is because the first test, it's sensitive, which means if you've got it, it'll show it, but it's not as specific, which means if the test is positive, is it really a true positive or is it falsely positive? So they then send those tests that have been tested positive to another lab, the one that typically has been, they send it to another lab, the CDC lab in Chantilly, Virginia, where a much more specific test is done. If that is positive, then they say it's a confirmed case.
And one of the tests was done in New York, and then the other one was done here, is that right?
No, No, when this individual came from New York to Northwest Arkansas, they just had symptoms. And so the first test was when we sent our nurse out to obtain the specimen. So they became a person under investigation because they were febrile, they had respiratory symptoms, and they had come from what we call an endemic area where the infection is widespread. That being the case, they qualified to get a sample obtained. So we sent our staff out, obtained the sample, drove it to Little Rock, and got the result within 24 hours. But until that time, they're a person under investigation. They were quarantined.
Okay, so, from the time that the person was picked up, is how I keep hearing it styled, to the time that the provider was sent to quarantine, that was approximately 36 hours.
That's approximately 36 hours.
Right.
Let's see, midnight,
Well,
24, oh, actually it was less than that. It was 33 hours.
Okay, 33 hours.
Mhm.
In your judgment, doctor,
Mhm.
did at all times, the two doctors involved here exercise the best possible judgment with regard to picking up, with regard to contact at home, with regard to coming back to work? All of that, in your view, were they exercising the best judgment possible under the circumstances?
I will cut on that because, again, I'm not going to express, I'm here to express.
We're still rolling too. I really don't want to turn the camera off.
Okay. I'm here to express the policy of Washington Regional and our response to this event. I'm not here to give you my personal opinion.
Okay, fair enough. Is it, and Andrew was going to ask you, is there anything you'd like to add? Is there anything that you think folks ought to know about any of the subjects we've talked about here, or some that we may not have that you think are important to bring
And that we
up?
missed.
Well, you know, I think to say that our hospital is as well prepared as possible is an understatement. Over 10 years ago, we developed a pandemic plan that we put in place just for this type of event. In fact, we actually have had storage on facility, on campus, for extra supplies, including caps, gowns, gloves, everything that you can think of to deal with a pandemic. And that plan has been in place for more than 10 years. We even went as far to purchase what are called disposable ventilators, because in this case, the problem that patients get that get them deathly ill is the inability to breathe on their own. So we purchased additional ventilators, which were the phrase is disposable. They're used one time and then they're dispensed of. But we purchased 50 of those, and today we've ordered 50 more.
Yeah, we know those are in high demand, and I think just today the president was talking about they put in some kind of program or it has to do with giving the private industry the liberty to mass produce certain items and
Right.
stuff like that. I forget how it's styled, but those ventilators are key.
Oh, they're absolutely key. And that's, you know, we've realized that for a long time.
Mhm.
And that's why if you had gone to our storage site, you'd find 50 disposable ventilators waiting for this.
Okay. Well, that's all the questions we have, unless there's any additions or.
I think one key point, Doctor, if you'll expand on what you expect from the public. We don't want them coming straight to the screening clinic.
Right.
We want them, I need y'all to really sell that.
Yeah, yeah. Well, I interviewed a doctor today, as a matter of fact. He's with the community clinic out of
Mhm.
Springdale,
Mhm.
and he made that point. You know,
Yeah.
what he's doing is sending them home and having them call if they need further. You know, don't
Yeah.
just.
Exactly.
Well, I think the key is the online screening, the phone call to the nurse
Mhm.
line, the phone to the hotline for our nurses.
Mhm.
And if you have those symptoms and pass those screening, then the screening plan.
Yeah, I mean, it's important to know, and this has been said many times, but I'll say it again, and that is, there will be many people who will become infected, but very few will become seriously ill. If you're not seriously ill, make the phone call at home, call the hotline, use the screening tool on online, call before you come. There are limited testing supplies, and what we don't want to do is to overwhelm the healthcare community. So please use the online screening tool. Please call. UAMS has an online screening tool. Arkansas Department of Health has a phone line. We have a phone line. Use those tools. If you can stay at home and recover at home, you should. If you are ill to the point where you're concerned, increasing shortness of breath, then you need to be seen, but call so that we can coordinate that. Call your primary care provider, if possible, to get good advice before you come to our screening center. Our screening center is here to be able to help cordon that infection in a way and get folks back home to stay home. But if they need the hospital, to get them to the hospital in a very coordinated fashion. You know, as far as screening, we've started screening Saturday. So we were, lack of a better phrase, first to the market in screening on Saturday, and our screening center opened on Monday. So thankfully, the number of viruses, the amount of virus that was in our community hopefully was negligible to none, but it will be here. And the fact that we have that screening center up and going will help to better efficiently deal with the demand that we're going to see. It's a challenge that we all have to overcome. It's a challenge we all have to meet. And it's important that the community, including our citizens and the healthcare providers, work in a coordinated manner to meet that challenge.